Hello, my name is Esther Cubo. I am a movement disorder neurologist. I work at the Hospital Universitario de Burgos, Spain. Previous literature has proposed a relationship between hypothalamic dysfunction and the limbic system with the development of non-motor symptoms in Huntington's disease. Among these neuroendocrine disturbances, there is a growing interest of the protective role of insulin-like growth factor-1, IGF-1, on metabolic and mitochondrial function in Huntington's disease. Moreover, IGF-1 receptors have been discovered in the amygdala and prefrontal cortex, which contribute to the neural circuits known as the social brain. Based on the above data, we have hypothesized that IGF-1 dysfunction will be associated with social cognition impairment and brain structural changes. Therefore, we aim to investigate the association of IGF-1 function with social cognition and brain structure in patients with Huntington's disease versus controls. A secondary objective was to understand the role of the global hypothalamic function in social cognition and apathy. This study was designed as a multi-center cross-sectional pilot observational study. Therefore, we studied social cognition using the Ekman 60 phase test in 22 not demented symptomatic HD patients and 19 gender age match controls. We compared IGF-1 levels, global hypothalamic function, and brain structure between HD patients and controls. For neuroimaging, we used a standard volume-based, voxel-based morphometry and surface-based cortical thickness pipeline. For analysis, we conducted a comparative univariate and multivariate adjusted regression analysis. In terms of sample characteristics, overall age, gender, and education were no different between HD and controls. However, higher intake of antidopaminergic drugs and antidepressants were found in the HD group compared to controls. In addition, worse cognition and higher apathy were found in the HD group compared to controls. In multivariate regression analysis, lower Ekman scores were more likely in HD patients on antidopaminergic drugs. However, in contrast, higher Ekman total scores were associated with higher IGF-1 levels. This model explained 69% of the variability of the Ekman total scores. In terms of hypothalamic function, HD patients had higher concentrations of vasopressin and higher urine and plasma osmolality, and a trend for higher levels of IGF-1 and lower levels of oxytocin in the HD group. For brain structure, as expected, HD patients showed widespread cortical and subcortical atrophy compared to controls. These areas of neurodegeneration were correlated with IGF-1 levels in the HD group, mainly in the frontotemporal regions. In conclusion, based on these preliminary findings obtained from a small sample, otherwise well clinically characterized HD cohort, our study suggests a hormonal clinical brain structure framework where abnormal IGF-1 function is associated with the brain atrophy, leading to clinical deficits in social cognition in the HD population. These results might help future studies to understand the pathophysiology of social cognition impairment and to develop therapeutic strategies.